how endometriosis may affect sexual function. All data, scientific data, and more important, all women experiences show that the first leading symptom of endometriosis is deep dyspareunia, say deep pain during intercourse. But of course, if I have pain every time I try to have an intercourse, then I will have vaginal dryness. Why that? Because pain is the strongest reflex inhibitor of vaginal lubrication. And if I have pain, I will contract the pelvic floor, the muscles that close and surrounds the vagina, because of pain. If I have pain in my shoulder, I contract. If I have pain there, I contract. But this is a very important point for other symptoms that women will complain of if we do not pay attention, first of all, to deep dyspareunia. Other symptoms, difficulty in orgasm, because I am overwhelmed by pain and I can't even imagine of an increasing of congestion and arousal when I really have to say, please stop, 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 pain. I can't bear this pain. And clearly, even desire goes away. So, if we look at the circuit of the sexual function, this is my model, inflammation and pain will affect mood, killing desire, will affect sexual desire and central arousal, will reduce or block genital arousal and lubrication, reduce the possibility of coital orgasm, say orgasm during intercourse, but these negative feedbacks from the genitals will progressively affect the whole perception of intimacy. They will reduce mood, cause depression, and also reduce the possibility of further desire. So a negative vicious circle is in play, progressively killing every dimension of sexual intimacy. So when a woman complains of pain during intercourse, what should we ask? What should you women tell your doctors, hoping that they will listen to you? Where does it hurt? Deep in the vagina. When does it hurt? When you have the intercourse. And what are the associated symptoms? Because this is critical to make a comprehensive diagnosis of comorbidities that I will show you in a moment. With these three questions, where does it hurt? When does it hurt? What are the associated symptoms? We will describe the pain map that is key to make a proper treatment. Now, remember this. Inflammation means to set on fire, from the Latin word inflammare. It is a biochemical fire that affects the pelvis, but also the brain. And these two inflammations will progressively reduce the sexual circuit until the woman really avoids any intimacy for fear of pain. You may ask, why are you keeping on talking about inflammation? Because the main correlate of pain is inflammation. The example that I give to my patient is this. When in a house you see smoke, it mirrors a fire inside. When in our body we see and we feel pain, it mirrors the intensity of the inflammation behind. So pain is a red alert on inflammation within the body. That's why we must pay attention to pain and the inflammation behind it. But if we have an inflammation that is a war within the tissue, who are the soldiers in this war? We have our soldiers, the mast cells that bridge the pelvic inflammation to pain and sexual symptoms. It is our army. When they are working normally, they are friends of us, they protect us. But in chronic inflammation, they become upregulated, they start firing everywhere, and they fire even more during periods, and this is why your symptoms get worse. Do we have evidence, histologic evidence, that inflammation is really critical to cause, maintain, and worsen pain and the tissue destruction that is associated with inflammation? Yes, we do have biopsies. We have a classic study that shows that in every inflamed tissues we have a significant increase in tissue mast cells, that are our soldiers that are firing. Degranulating mast cells have released their content in the tissue, and very interesting, the mast cells close to the pain fibers. They talk to each other and they tell to each other what's going wrong in the tissue, but the mast cells that speaks to the pain fibers will also increase the alarm in the brain. So the anxiety, depression, night sleep disorders, fatigue, and this general sense of hopelessness. So very important. The triad is present in every tissue that is inflamed, but we have a very specific research by ANAF, published on fertility and sterility, showing that really with the immunostaining, the immunotryptase soldiers, say the mast cells, are firing in every part of the pelvis where inflammation is proven. They are firing, degranulated, and they're very close to the pain fibers. So we have evidence that really inflammation is key in endometriosis. Pain is related to inflammation, and this means why we should reduce the inflammation if we want to reduce pain. In particular, if you record the correlation between the peaks of pain and your periods, you have this wonderful, wonderful picture showing to every doctor in the world that really this is the problem. If you have a pill but you have the 7 days off, there you have the peak of pain, like in the normal periods. But if you take away the hormone-free interval, these peaks disappear. So very important. What's the point? If I do not pay attention to this, I have a progression of dyspareunia to other point. Introital pain, say the tightened pelvic floor, will cause vulvovestibulitis, and if I do not pay attention to that, I will have a further actor in action, say the bladder symptoms. So the other critical problem is that if I do not make an early, accurate diagnosis, symptoms will worsen, other organs will be involved, and this deep dyspareunia will be complicated with introital dyspareunia, say pain at the intrus of the vagina, the evil twins, and if I still do not pay attention to that, bladder symptoms, the third actor of pain. That's why pain at intercourse must be considered very seriously, because really we can change the destiny if we pay attention to these intimate symptoms, the sooner the better.